When we lose choice for our healthcare needs, it narrows the field of possibility for treatment and care options. If we only have one hospital to choose from, we are at the mercy of that hospital. We hope the treatments it provides are the only ones we need, but what if they're not? Studies have shown that people who don't have easy access to needed care either substitute primary care for specialists, postpone care, or simply don't go at all because of the double burdens of cost and long travel time associated with care that is far away. Consider your nearest big box store. At Big Box, I get an all-in-one stop for food, clothes, and household goods. This is great because I can go to one place for everything. Except the big box near me doesn't carry the brand of tomato sauce I like, and their clothes aren't really my style. And the last time I looked for patio furniture, they had 3 kinds, but not the one I wanted. But they have a low, low price. So I tried a new brand of tomato sauce and skipped the clothes and patio furniture. I still got some of the things I wanted because I was willing to choose from the only options given to me, but I didn't really get everything I wanted. Now, I still have the option to go get my patio furniture and my new dress from another store, but what if I didn't? What if instead of patio furniture, it was IV antibiotics or chemotherapy? And what if there was no low price to make it worth my while? This past April, NPR ran a series about unusual hospital bills. In the story, a man had gotten 2 CT scans, one that cost $300 at an imaging center, and another that cost $9,000 at an emergency room. The city he lived in had gone through a consolidation of healthcare providers. They ended up with a big box health system. The big box health system owned so much that people's choices were reduced to going to a big box health center and paying the big box price, or traveling farther away where they could access the less expensive CT scan. Now, not only did the patient in the story end up paying these vastly different amounts of money for the same service, but the amount of money the insurance company paid out was more expensive for big box health as well. No one saved any money. This is a great example of how systems with consolidated health are not providing savings or other benefits to people who need the care. To stop this from happening, we need to support the smaller local systems so they can continue to provide us with a competitively priced care in a variety of options. In other words, break your leg local. If we lack options in primary care providers, we are at the whims of a small group of providers, not just for our ability to save money, but for our treatment options. What do you do and who do you turn to if the only primary care doctor in your region isn't willing to provide a new treatment or refuses to provide a treatment that goes against their beliefs, even if it's one you need? What if your doctor simply doesn't believe the symptoms you're having? People with chronic pain syndrome and fibromyalgia have a long history of ignored and misdiagnosed conditions. It was only through access to multiple providers that they could find people willing to listen to them and treat their medical concerns. If there is a lack of diversity in home care services, you are instead left with one large VNA who may not be able to schedule you when you need and who may only have a limited number of staff who cover your area. If you have lousy insurance or a lack of support at home, they may simply refuse to take you under care and you will have no other option. This holds true for dying people who want home hospice as well. Imagine even losing the right to die how you want. Utilizing a local healthcare system allows a more individualized care path and helps create a more robust system of care, which builds a safety net for yourself and others. In other words, break your leg local. People should be wary of huge health systems that dictate the type of care they can and cannot receive. Big health systems are telling us all the time that bigger is better, yet in study after study, they have failed to find cost savings or improvement in health outcomes by putting the other local providers out of business. A recent article in The Balance determined we had an annual health care cost of $10,348 per person in 2016, compared to $146 in 1960. This despite a steady decline in the number of hospitals since 1970. What has been shown to make a difference is when people move from hospital level of care to skilled rehab or nursing, followed by a visiting nurse. This avoids longer hospital stays and has been shown to reduce the number of people coming back into the hospital within 30 days of their discharge. It gives patients a supported return to their lives. In fact, it was the subject of the September-October 2017 Remington report, which reviewed over 8,700 patient outcomes. For many other patients who aren't as ill, it could simply be a visit to your primary care office, followed by a referral to a visiting nurse agency. This plan gives you the care you need now and is drastically less expensive than in-hospital care. It's this stepwise fashion of care that seems to be producing the best outcomes, and it's in large part due to the strength of communication between these different levels of care. Now, not only does this reduce rehospitalization rate, it results in higher patient satisfaction. We like this style of care better, and it's better for us. This very reason is why the Center for Medicare and Medicaid Services made it a patient's right to have a choice for who they choose for providers, whether that be for specialty care, primary care, or home care. When patients are not given a choice, it is not only a travesty of health care, it is illegal. Your local providers are a microcosm of your community, and they better understand how to get you connected to the resources that give you better health. People want truly personalized health care. You want to be able to call up your nurse and say, I need a visit today, things just don't seem right. Your nurse can come on over and assess you in your own home. Based on that assessment, the nurse can provide direct care, send you to the emergency room, or call the local provider's office and get you fast access to a same-day appointment, all depending on what you need. The ability to do this is possible through trust, built up not only between the nurse and the patient, but between the nurse and the doctor's office. This strength of communication can help get you the care that you need faster, and in many cases without an expensive and long emergency room visit. That same local healthcare system can connect you to the local resource groups to help connect people to resources like Meals on Wheels, electricity assistance, or grief support, substance abuse, or chronic disease management support groups. Break your leg local. Large health organizations are telling us all the time that they want to capture our care, but really they want to capture our business. From primary care specialists to hospitalizations to home care and finally to hospice. But healthcare has a difficult time scaling to size, and when it does, the cost savings are realized only by the healthcare system, not by the consumer. Remember the NPR story about the 2 CT scans from earlier? Your ER visit doesn't cost you less, the hospital just makes more money, and you still have large health organizations driving out smaller ones, eliminating options in healthcare. Now, instead of any primary care doctor, you have fewer to choose from, or you need to travel farther to get to your chemotherapy because your local provider went out of business. It extends the time that you're traveling in an ambulance in an emergency until you reach a hospital, and it leaves you farther away from your family and loved ones once you arrive. These are the people who help you make treatment decisions, plan for when you're back home, and take you to follow-up appointments. The same thing can happen with primary care, labor and delivery, home care, hospice. The large healthcare organization can and does steer you to its own provider network. You are the commodity in this system. You lose the ability to choose from a wide local pool of providers and are instead funneled into a narrow system where there are few choices for the type of care you receive. It also causes care to become concentrated in metropolitan areas, leaving rural and even suburban areas without adequate care options. These same areas also tend to struggle with transportation, creating an additional barrier to follow-up care. When healthcare consolidates, you buy big box, or you don't buy anything. Except with big box stores, we're making a choice to limit our options in tomato sauce and t-shirts and patio furniture because we get low prices. And when healthcare consolidates, we get limited options and none of the benefits. This creates a cycle of missed or delayed care, which leads to further emergency room visits and hospitalizations. It only increases healthcare spending for everyone. For some specialists, rare cancers, infrequently seen genetic disorders, or unusual diseases, we don't want or need many local options. There is a place for the Mayo Clinics of the world. But if we are not active consumers of healthcare, if we don't understand we have the right to know what our options are and to choose the one that fits our needs the best, then those choices will disappear and we will be left with no choice at all. Local health care is a right, but one we must defend. Patients must be given the right to choose. If patients do not have a preference, the big box healthcare system is free to recommend its choice, in effect leading us all lemming-like to the health system big box health has chosen for us. a care system not chosen because of excellence or because it gives back to its local community, but one who will generate the most profits. They are, in effect, lining their own pockets when sick and dying people place their trust in them. How can we fight this? Seek out your local healthcare. Seek out the healthcare that fits your needs the best. Foster your local healthcare environment for the same reason that people support the locavore movement and small businesses. Just as this movement made us realize the importance of knowing where our food comes from and supporting our local farmers and food producers, I say there should be a local healthcare movement. Know where your healthcare comes from. You deserve easily accessible local healthcare. In rural communities with poor access to health, it's these organizations that provide much or all of the free care and community health education. That can make the difference in getting inexpensive preventative care versus expensive emergency-only care that drains the taxpayer-funded health system. You need and deserve a choice in who provides your health care. A strong local healthcare system keeps you healthy and keeps your neighbor healthy, which lowers insurance premiums and hospital costs. It supports a healthy workforce, creates local jobs, and acts as a draw for people to move into the community where you live. Just as buying local will support your businesses for a strong local economy, a strong local healthcare system will support the health of your local businesses. You have the right to choose your providers, and if a hospital or other system tries to deny you that choice or steer you to a particular provider, complain. Complain to the Center for Medicare and Medicaid system. Complain to your local paper, on Facebook, anywhere you feel you have a voice. We are not sheep. We are not lemmings. We are not the commodity. We are people, sick, healing, or dying. And we, all of us, should get the health care that we deserve. In closing, I wish you health. But if you break your leg, break it local.